Welcome to This Explainer. Today, we're diving into a really complex and honestly, often completely misunderstood area of gynecological health. We're going to take a journey together to decode the medical realities of endometriosis and adenomyosis. If you, or maybe someone you know, has ever struggled with unexplained pelvic pain, you know exactly how frustrating the search for answers can be. So let's get into it and decode what's actually happening inside the body.
Okay, let's dive into this. Is worsening period pain actually normal? So many people just accept escalating pain as a routine part of life, like it's just something you gotta power through. But medical professionals are crystal clear on this. Pain that consistently gets worse is a massive red flag. It's literally your body's alarm system going off. If you're experiencing this, your concerns are absolutely valid. It's not just in your head, and it's for sure not something you should just ignore.
Here is our roadmap for today. First, unmasking severe pelvic pain. Second, what is endometriosis? Third, the treatment toolkit. Fourth, understanding adenomyosis. And finally, taking control of health.
Section 1. Unmasking severe pelvic pain. The reality of living with an invisible intruder.
When we talk about this invisible intruder, the symptoms are incredibly diverse and, honestly, deeply disruptive to everyday life. We're not just talking about a bad cramp here. We are talking about worsening period pain that actually intensifies over time. And the worst part? The pain doesn't even wait for a menstrual cycle. It can strike as pain between periods, pain during sex, and even pain during bowel movements. Just imagine trying to navigate your daily routine, your relationships, and just basic bodily functions while managing this entire spectrum of pain. It is totally exhausting. By calling out these very real symptoms, we can really start to see just how significantly these conditions impact the people living with them.
Let's move to Section 2 and see how this builds. What is endometriosis? The biology behind the pain.
So to understand the disease, we first got to understand normal biology. The root word here is endometrium. That's simply the lining on the inside of the uterus. And medical experts use this brilliant analogy for it. Think of the endometrium as a baby's bed. Basically, the body biologically prepares this soft, nutrient-rich lining just in case a pregnancy happens. If a pregnancy doesn't occur, well, the body doesn't need the bed anymore, so it breaks it down and sheds it. And that shedding process, that's exactly what we know as a period. It's an incredibly efficient, well-designed biological system.
But here is where the invisible intruder completely breaks the rules. Endometriosis happens when that exact same tissue, that baby's bed, somehow ends up growing outside of the uterus. And it creates this literal biological trap. First, the rogue tissue sets up shop where it absolutely doesn't belong. Then, when your body's hormones send out that monthly signal to prepare for a period, this rogue tissue actually obeys those orders. It thickens up, just like the tissue inside the uterus. So when the signal comes to shed, it bleeds. But because it's outside the uterus, that blood has absolutely nowhere to go. It bleeds internally. And this internal bleeding leads to inflammation, cysts, and intense chronic pain. It's doing exactly what it was programmed to do, just in the completely wrong place.
So where exactly does this rogue tissue set up camp? Well, it's pretty stealthy. It can hide deep within the ovaries, scatter across the general pelvic area, or even wedge itself into the incredibly tight spaces between the uterus and bladder or the uterus and rectum. When you think about those specific locations, it suddenly makes perfect sense why patients experience pain during sex or bowel movements, just like we talked about earlier. The intruder is literally occupying the spaces right next to these vital organs.
Moving right along to Section 3, the treatment toolkit. How exactly does medicine fight back?
Now, before doctors can fight back against this intruder, they basically have to act as detectives to confirm it's actually there. They rely on three main diagnostic tools. First up, a transvaginal ultrasound, which gives them a really clear, immediate picture of the pelvic organs. Second, MRI scans, which provide highly detailed imaging to track down tissue that might be hiding in those complex spaces. And third, a specific blood test that looks for elevated levels of CA-125, which is a marker that can strongly indicate the condition is present.
Once diagnosed, doctors look really closely at the size of any cysts that might have formed, especially in the ovaries. And 5 centimeters is a pretty critical medical threshold here. To put that into perspective, if a cyst caused by endometriosis is 5 centimeters or larger, doctors usually determine that surgical intervention is the way to go. But if the cysts are smaller than that mark, the condition can often be managed straight up with medication.
Now, what's really interesting about this is that when surgery isn't required, doctors have this fascinating arsenal of hormonal treatments they can use.
Basically, by tweaking the hormones that feed the rogue tissue, doctors can essentially starve it out. The most common approach is the low-dose pill, or LEP. You take it daily to gradually shrink the cysts, though you do need some patience because it takes time to work. Another option is the progestin-only pill, which uses just a single hormone as an alternative. And finally, for more severe cases, doctors might use GnRH agonists. This is a really powerful treatment that temporarily stops your periods altogether.
While those GnRH agonists are super effective at stopping the bleeding by putting the menstrual cycle on pause, it's absolutely crucial we understand the trade-offs of this aggressive approach. Because it rapidly drops your hormone levels, it actually induces a sudden, temporary menopause-like state. Patients might deal with hot flashes, headaches, and some pretty intense fatigue. On top of that, with long-term use, there's a noted medical risk of bone density loss. So, it's a remarkably powerful tool, but definitely one that requires really careful medical monitoring.
Well, listen, hormone therapy is not the right path for everyone. Whether it's because of the side effects, personal preference, or other health factors, some patients just can't or simply prefer not to use hormones. And for those individuals, targeted symptom management is a totally valid and necessary medical pathway. This can look like the strategic use of painkillers to manage flare-ups. And in some practices, they even integrate compo, which is traditional herbal medicine, to help keep those symptoms under control and just generally improve daily quality of life.
This brings us to a bit of a plot twist in Section 4, Understanding Adenomyosis, when the intruder hides inside. And this brilliantly illustrates the boundary between these two really similar yet biologically distinct conditions. As we just learned in endometriosis, that rogue tissue grows entirely outside the uterus, so the ovaries, the pelvis, and so on. But in adenomyosis, that exact same rogue endometrial tissue grows inside the muscular wall of the uterus itself. It's essentially a close cousin to endometriosis. It uses that same biological trap of bleeding during a period, but it's doing it trapped within the tight muscular confines of the uterus.
Because this tissue is trapped right inside the muscle, adenomyosis actually causes the uterus to enlarge, and it results in notoriously heavy menstrual bleeding. Now, the treatment protocol does involve those same hormone therapies we just reviewed. However, because of the sheer volume of blood lost during these intensely heavy periods, patients with adenomyosis very frequently require a dual treatment approach. Doctors have to treat them for anemia at the exact same time, just to replenish their depleted iron and red blood cell levels.
Finally, let's wrap up with Section 5, Taking Control of Health, Empowering Yourself with Knowledge.
So the crucial point here, and this is a direct quote from the medical source material, is that increasing menstrual bleeding is not natural. Bleeding naturally decreases with age. As we get older, our natural biological clock dictates a reduction in menstrual flow. So if you're finding that your periods are getting progressively heavier or the pain is consistently getting worse over the years, that is your body waving a massive red flag. Turning that simple biological fact into a vital health warning is probably the single most important takeaway today for anyone monitoring their own health.
We also have to connect this biology to real-world life goals. Because endometriosis and adenomyosis cause inflammation, cysts, and actual architectural changes in the pelvic region, they can really hinder a person's ability to get pregnant. So if a patient is trying to conceive, the medical strategy often has to shift. Instead of just suppressing the cycle with hormones, doctors frequently recommend prioritizing active reproductive medicine and stepping right into fertility treatments to help patients reach their goals safely and effectively.
As we wrap up this explainer, I really want to leave you with one final important question. What unnatural changes are you ignoring in your own body? We've learned today that worsening pain and increasing bleeding are absolutely not things you should just push through. This invisible intruder thrives when we dismiss our own symptoms. So if any of this resonated with you today, please don't ignore it. Use this knowledge to advocate for yourself and seek professional medical clarity. Thank you so much for learning with me today.